With true collaboration, everybody has to leave their egos at the door. I mean, we all come from a different perspective and have a different lens, but in the end, our ultimate goal is to help the community that we serve. And it's that commitment of everybody that does come to the table that I think truly makes the difference in listening to the community that we are serving. When I first started in 1988, everything that we did, we had to look up to help somebody. We had directories or phone books. If somebody needed help, we would kind of go through that process with them and try to go along and get them the help they needed. And you became invested in those consumers when you did that. So through the years, when I saw that we were making a difference in people's lives, that kind of triggered something in my brain and in my heart. And I said, I feel like this is something I can do. So I found that the gifts that I have were empathy and compassion. And that's why I kind of continued along that route. It is difficult sometimes, but I feel that connecting those dots, again, like I said, is really helpful for some people that might not have the perspective from one or the other kind of division, and making it sure that they all flow. It was definitely a collaboration in bringing all of those initiatives to Burlington County. And what I thought about the Live Project and the film My Sister Lived, about what happens after suicide of a young life, and all the people that it affects and the impacts that it has on their lives. Like, we're finding that bullying is one of the main reasons that some youth are taking their lives, is bullying, because words do hurt. And our mental health is something just as important as taking care of our physical health. And if you eliminate derogatory words when you're dealing with mental health or substance use disorders, by identifying a person by that mental health disorder, we try to eliminate that. The pandemic, honestly, opened those doors a lot more, because people who might not normally have freely expressed their mental health status were able to do that during the pandemic. So if anything good came out of that, people were more open to saying, I'm not okay, and others to say it's okay to not be okay. I was certified as a traumatic loss counselor in 2020. CIT trainings are a 40-hour training. It's an evidence-based model, and we hold it a couple times a year. And it's, again, a collaboration of providers and experts in the field. What I think it brought to the table was the first responders learned that there were other resources out there for them other than just going to the emergency room or to the jail. Bringing somebody who might be in distress or in crisis in the community the help that they needed, instead of cycling through the system, just getting called out over and over again, and able to de-escalate when somebody's in crisis. We taught them de-escalation skills. I loved watching the collaboration, even between providers, whether it's Oaks or any other provider. They would come to the table and address whatever need they felt needed. It actually means a lot to me to receive this award. The Rooted in the Community Awards is a validation for me, because sometimes I question if I'm making a difference. Sometimes you question yourself on a daily basis, because you don't always get to see the outcome of when you're helping a person. You don't always get to find out on the other end of the phone if they got the help that they need. Everybody doesn't fit into a cookie cutter box when you're trying to help somebody. You try to wrap something around a person based on their needs. It's mostly just definitely done from the heart and no other motive, really.